Have you ever felt a sudden, unsettling shift in your body? A silent alarm bell ringing that something isn't right? What if ignoring that whisper could lead to a life-altering event? Today, we are going to reveal 7 critical bodily signals that should never, under any circumstances, be dismissed. These are the unequivocal red flags that medical professionals emphasize require immediate attention. At a hospital, no hesitation, no delay. If you're watching this video right now, comment "Great" below, because you're taking a vital step towards safeguarding your well-being and the well-being of those you cherish. This isn't about instilling fear. It's about equipping you with the knowledge to act decisively when it truly matters. Many older individuals sometimes delay seeking medical help, perhaps attributing symptoms to aging or not wanting to trouble others. However, in numerous instances, swift intervention can prevent a minor issue from escalating into a significant health crisis. More importantly, understanding these crucial warning signs empowers you to take control of your health journey. In this video, you will learn about 7 undeniable alerts your body might send, signals that doctors insist you must never disregard. These aren't vague, general symptoms. They are specific, tangible, and often time-sensitive. Stay with us until the very end, as recognizing just one of these signs could potentially save your life, or the life of someone you hold dear. Let's delve into these critical indicators, starting with what is often considered the most time-critical. 1. Let's discuss the sudden onset of slurred speech or facial drooping. There's a very specific combination of symptoms that healthcare professionals are trained to identify immediately, and they point towards a medical emergency that demands instant action: stroke. If you abruptly experience difficulty articulating your thoughts, find that your words are coming out jumbled or unclear, or observe that one side of your face appears immobile or droops unevenly when you smile, you must seek immediate medical attention at a hospital. The same urgency applies if you find yourself unable to lift one arm, or if it involuntarily drifts downwards when you attempt to raise both arms. These are not signs to simply rest and hope they pass. They are strong indicators that your brain may be facing a serious crisis. A renowned neurologist once stated that for every minute a stroke goes untreated, an astounding nearly 2 million brain cells are lost. Time, in this context, isn't just a concept. It represents memory, the ability to speak clearly, physical movement, and indeed, life itself. This is a stark reality that many individuals don't fully grasp. In older adults, strokes can manifest without any prior warning. You could be enjoying a typical day, perhaps reading the newspaper, watching television, or having a meal, and suddenly your words don't form as you intend, or your smile appears lopsided. These subtle alterations might feel peculiar, but not necessarily alarming. And that's precisely what makes them so perilous. Because when it comes to a stroke, the sooner treatment is administered, the greater the likelihood of a full or significant recovery. Consider the experience of Thomas, a 70-year-old retired engineer residing in Ohio. One morning, while enjoying his routine cup of coffee, he unexpectedly dropped the mug from his left hand and couldn't comprehend why. He called out to his wife, but the sounds that came out of his mouth were distorted and unintelligible. His wife, noticing the distinct droop on one side of his face and the crookedness of his smile, immediately dialed 911. Thomas received crucial medical intervention within the critical first hour and thankfully made a remarkable recovery. He later reflected that if his wife hadn't acted so swiftly, he might have faced severe long-term disabilities. The medical community widely promotes the acronym FAST-face drooping, arm weakness, speech difficulty, and time to call emergency services to educate the public on how to recognize a stroke. However, the most crucial element, often overlooked, is the final letter, T for time. Every minute is critical. If you observe slurred speech, an uneven facial appearance, or sudden weakness, do not hesitate or delay by waiting for a doctor's appointment. Immediately contact emergency services and get to a hospital as quickly as possible. When your brain is in jeopardy, acting with speed can be the deciding factor in preserving your ability to walk, speak, remember, and live independently. If you've learned something vital about recognizing stroke symptoms, comment "Act fast" below. 2. Now, let's move on to the critical warning sign of sudden chest tightness or pain. One of the most urgent signals your body can send is an abrupt, unexplained discomfort or pressure in your chest area. This sensation might manifest as a constricting tightness, a squeezing feeling, or even a burning sensation, and it can potentially radiate to your arms, shoulders, neck, or jaw. While some individuals might try to rationalize it as mere heartburn or anxiety, the truth is that this could be your heart desperately signaling for help. This is particularly critical in older adults, as the indicators of a heart attack can be subtle, develop gradually, or even present in a way that is entirely different from what one might expect. A seasoned cardiologist once lamented the number of patients who arrived at the hospital too late because they initially mistook their heart attack symptoms for simple indigestion. This is a truly heartbreaking reality. If there's even the slightest possibility that your chest discomfort could be cardiac-related, it is imperative to get it checked out immediately. This statement holds profound truth, especially considering that many heart attacks in seniors do not present with the classic crushing chest pain often depicted in media. Sometimes it might be a dull ache, a fluttering sensation, or simply an inexplicable feeling that something is profoundly wrong. You might also experience dizziness, shortness of breath, or sudden, overwhelming fatigue, even without any preceding physical exertion. These are not symptoms to simply monitor. They demand immediate action. Take the case of Emily, a 76-year-old retired teacher residing in Florida. One afternoon, while quietly reading a book, she felt a peculiar tightness in her chest. It wasn't intensely painful, but it persisted. She initially thought it might be gas, but an inner voice urged her to contact her daughter. Her daughter promptly came over and insisted on taking her to the nearest hospital. Emily had indeed suffered a mild heart attack. Thankfully, due to the swift medical intervention, she made a complete recovery. She later shared that if she had delayed seeking help, the outcome might have been drastically different. The crucial lesson here is that when your body is in distress, especially concerning your heart, it doesn't always scream. It often whispers. And with something as serious as heart trouble, those whispers can be a final warning. Do not wait until the pain becomes unbearable or you find yourself unable to breathe. If you experience any unfamiliar or persistent chest discomfort, particularly if it's accompanied by other symptoms like shortness of breath, dizziness, or nausea, go to the hospital immediately. Don't second guess, don't delay, just go. If you find this information about heart health crucial, comment "heart health" below. 3. This time, let's discuss the concerning symptom of shortness of breath without any physical exertion. There's a significant distinction between feeling winded after climbing a flight of stairs and experiencing the sensation of being unable to breathe while you are completely at rest. If you find yourself gasping for air during a quiet moment, whether you are reading on the sofa, watching television, or even lying in bed, this is not something to simply dismiss. Sudden breathlessness that occurs without any preceding physical activity can be a significant red flag for serious underlying medical conditions such as heart failure, pneumonia, or even a pulmonary embolism, which is a potentially life-threatening blood clot in the lungs. All of these conditions necessitate urgent medical attention. A seasoned respiratory specialist once emphasized that if breathing becomes markedly difficult for no apparent reason, that is your body sounding a serious alarm. It's not simply a sign of aging or fatigue. It's a genuine cry for help. This statement resonates particularly strongly for older adults. While it's true that as we age, our lung capacity naturally tends to decrease, and our heart has to work harder to efficiently pump oxygen-rich blood throughout the body, What truly differentiates a normal age-related change from a critical medical emergency is the suddenness of its onset and the severity it reaches. If you find yourself breathing heavily after performing a simple task like walking across a room, or if you wake up in the middle of the night feeling as though you cannot catch your breath, something is undoubtedly wrong. The issue might originate in your lungs, your heart, or a combination of both, and delaying medical attention could lead to a worsening of symptoms or even irreversible damage. Consider the experience of William, a 78-year-old retired carpenter residing in California. He had always maintained a relatively active lifestyle. However, one evening, while relaxing and watching his favorite program, he suddenly felt as though he couldn't get enough air. There was no accompanying chest pain, no fever, and he hadn't engaged in any strenuous activity. Just this overwhelming sensation of breathlessness. His daughter, sensing the urgency in his voice, convinced him to go to the nearest hospital. There, doctors discovered a small but significant blood clot in his lung. William later stated that if he had waited until morning, he might not have survived. The critical takeaway here is that sudden shortness of breath is not something to monitor and address later. It demands immediate action, especially when it appears abruptly, worsens rapidly, or makes even the simplest daily tasks feel like an intense workout. Trust your body's signals. It often knows when something is amiss, even if you cannot immediately pinpoint the exact cause. If you experience difficulty breathing for no obvious reason, proceed directly to the emergency room. It is always better to err on the side of caution and discover it was a false alarm than to delay and face potentially dire consequences. If you understand the importance of addressing sudden breathlessness, comment "Breathe easy" below. I believe you're enjoying this video and gaining valuable insights into these critical warning signs. Before we continue with the next crucial point, make sure you take a moment to subscribe to our channel if you haven't already. Give this video a thumbs up if you're finding it helpful, and share it with your friends and family. This information could be life-saving. Comment "Wonderful" below if you're enjoying this video so far. Your support enables us to continue creating informative and empowering content for you. Now, let's move on to the next vital sign. 4. Now, let's discuss the significance of unusual confusion or sudden disorientation. When an older adult suddenly becomes confused, struggles to remember familiar things, or appears disoriented regarding their location or the current time, it's easy to attribute it to simply getting older. However, this kind of mental fog that appears rapidly, especially if it represents a significant deviation from their normal behavior, is one of the most serious warning signs there is. It could potentially indicate a stroke, a brain infection, dangerously low oxygen levels, or even a severe adverse reaction to medication. Each of these possibilities requires immediate medical evaluation and intervention. A hospitalist with extensive experience in geriatric care once shared that in older adults, the brain is often the first organ to signal that something is amiss. Sudden confusion, they emphasized, is akin to the body's emergency light flashing. This observation is particularly important because many seniors and their families might not immediately recognize sudden confusion as a medical emergency. They might mistakenly believe it's just temporary tiredness or a bad day. However, when the change is abrupt and significant, such as forgetting the names of close relatives, getting lost in familiar surroundings, or speaking in a manner that doesn't make logical sense, it is crucial to take it very seriously. These are not gradual memory lapses. They are abrupt shifts in mental state that often signal a much deeper underlying medical issue. Consider the experience of Cynthia, an 82-year-old woman who lived independently and capably managed her own affairs in a quiet neighborhood in Illinois. One morning, her concerned neighbor found her standing in the hallway of their apartment building, visibly distressed and unsure of how she had gotten there or why. She was fully dressed, but seemed agitated and kept repeating the same simple question. Her family initially suspected dehydration or fatigue, But when they brought her to the hospital for evaluation, she was diagnosed with a urinary tract infection UTI that had triggered a sudden onset of delirium. Following treatment with antibiotics and intravenous fluids, Cynthia made a full return to her normal cognitive state within a few days. Her daughter later commented that she had no idea a simple infection could manifest as such profound confusion, and vowed never to ignore such symptoms again. This outcome underscores a crucial point. The brain is incredibly sensitive, and in older adults, it often responds to other bodily problems, such as infections, lack of oxygen, or even fluctuations in blood sugar levels, before other more obvious symptoms appear. Therefore, when confusion strikes unexpectedly and out of the blue, do not wait to see if it resolves on its own. While it might, if it doesn't, or if it progressively worsens, the potential consequences can be irreversible. If you understand the critical nature of sudden confusion, comment "clear mind" below. 5. Let's now turn our attention to the alarming symptom of severe or sudden abdominal pain. We all experience minor aches and pains from time to time, especially as we age. However, when that pain is sharp, develops abruptly, or feels like it's intensifying by the minute, particularly in the abdominal region, it is not something to simply ignore or try to wait out. Severe belly pain can be a sign of a serious medical emergency requiring immediate intervention, such as appendicitis, a perforated ulcer, pancreatitis, or even internal bleeding. In older adults, abdominal pain can also indicate a blocked intestine or a ruptured organ, both of which can rapidly become life-threatening if not treated promptly. A seasoned trauma surgeon once explained that when a senior patient reports sudden, severe abdominal pain, medical professionals treat it with the utmost seriousness because time can be the critical factor that distinguishes between a fixable problem and a fatal outcome. This perspective is crucial to remember. For seniors, the risk of complications from abdominal issues is generally higher, and the classic signs of illness might not always present in the typical way. You might not even have a fever or visible swelling. You might simply feel profoundly unwell, or you might experience sudden, intense pain that causes you to double over without any prior warning. Either way, your body is communicating that something is seriously wrong, and you need to respond swiftly. Consider the experience of Samuel, a 74-year-old widower who prided himself on his resilience and stoicism. One evening, while finishing his dinner, he felt a sudden, stabbing pain in his lower abdomen. He initially dismissed it as gas, took some over-the-counter antacids, and went to bed. By the following morning, the pain had spread throughout his abdomen, and he was so weak that he was unable to stand. His concerned daughter immediately called for an ambulance, and the emergency room team quickly identified a twisted section of his intestine that had completely cut off blood flow. Emergency surgery was necessary and ultimately saved his life. Samuel later admitted that he had thought the pain would simply pass and hadn't realized how rapidly such a condition could deteriorate. This story is not uncommon. Seniors often tend to downplay pain or wait to see if it improves on its own. However, when the pain is sharp, persistent, or unlike anything you have experienced before, it is not the time to tough it out. It is time to seek immediate medical attention. You will not lose anything by being cautious, but you could potentially lose everything by delaying necessary treatment. If you experience intense abdominal discomfort that does not subside, especially if it is accompanied by nausea, vomiting, or dizziness, do not try to self-diagnose or rely on internet searches. Go directly to the nearest hospital emergency room. If you understand the urgency of severe abdominal pain, comment "gut feeling" below. 6. Now, let's address the concerning symptom of persistent vomiting or vomiting blood. Experiencing vomiting occasionally, perhaps due to food poisoning or a stomach bug, is certainly unpleasant, but usually resolves within a short period. However, when vomiting continues for several hours, or if there is any presence of blood mixed in the vomit, it transcends being a simple nuisance and becomes a serious medical concern that warrants immediate attention. Persistent vomiting can rapidly lead to severe dehydration, electrolyte imbalances, and even kidney complications. Vomiting blood, regardless of the amount, can be a sign of a much more dangerous underlying condition, such as bleeding in your stomach, a tear in your esophagus, or ruptured ulcers. A seasoned gastrointestinal specialist once stated unequivocally that blood in vomit is never normal. It is one of the most immediate indicators of internal bleeding, particularly in older adults, and this should immediately raise alarm. It's important to note that some individuals might downplay this symptom or misidentify the blood. The blood might appear bright red, or it could have a darker, grainy consistency, resembling coffee grounds, which might be unexpected. Regardless of its appearance, it signifies that something is going wrong within your digestive tract. For seniors, this could be a reaction to certain medications, such as non-steroidal anti-inflammatory drugs and NSAIDs, a complication of an undiagnosed underlying medical condition, or even stress-related damage to the lining of the stomach. Consider the experience of Belinda, a 79-year-old woman who had been regularly taking over-the-counter pain relievers to manage her arthritis. One evening, after dinner, she began to vomit. Initially, she suspected the shrimp she had eaten. However, when she noticed dark flecks in the sink, which she initially mistook for old food particles, her alert grandson insisted on calling for emergency medical help. At the hospital, doctors confirmed that Belinda had a bleeding ulcer that had been silently developing for several months. She admitted that she had no idea the situation was so serious and later acknowledged that if she hadn't sought medical attention when she did, the outcome might have been fatal. This is a warning that cannot be overstated. Vomiting blood is not something that can wait until morning. It is not something to try and sleep off or treat with home remedies. It signifies that something within your body is damaged and is leaking blood into places it shouldn't. Whether it's a damaged stomach lining, liver complications, or a burst blood vessel, only immediate medical care can accurately determine the source of the bleeding and stop it in time. If you ever experience vomiting blood or persistent vomiting that doesn't subside, seek immediate medical attention at a hospital emergency room. If you understand the severity of persistent vomiting or vomiting blood, comment "Stay hydrated" below. 7. Finally, let's discuss the critical warning sign of a high fever accompanied by a stiff neck and sensitivity to light. When you develop a fever, it's usually an indication that your body is actively fighting off an infection. However, if that fever is significantly high and is accompanied by a stiff neck, a severe headache, confusion, or increased sensitivity to bright lights, it could be a sign of meningitis, a potentially life-threatening inflammation of the protective membranes surrounding your brain and spinal cord. While meningitis is more commonly associated with younger individuals, it can absolutely affect older adults, particularly those with weakened immune systems or other pre-existing health conditions. When it does occur in seniors, it can progress very rapidly. An experienced emergency physician once stated that if an older adult presents with a high fever and an inability to bend their neck or an extreme aversion to light, it is treated as an immediate, high-priority emergency. This level of urgency speaks volumes. By the time these specific symptoms manifest, the infection might already be in full swing. The stiffness in the neck is not just a minor discomfort. It's your body's way of signaling that the delicate linings around your brain are inflamed. Similarly, the intense sensitivity to light is not merely an annoyance. It's a sign that your central nervous system is under attack. For some individuals, these symptoms might also be accompanied by nausea, vomiting, or a sensation that their head is about to explode from internal pressure. None of these symptoms should ever be dismissed as just a common viral infection. Consider the experience of Gregory, a 75-year-old widower and avid crossword puzzle enthusiast residing in a quiet town in Montana. One morning, he found himself unable to concentrate on his daily puzzle due to a severe, throbbing headache. By the afternoon, His neck had become so stiff and painful that he couldn't comfortably look down, and the natural light streaming in from his kitchen window felt intensely unbearable. Thankfully, his neighbor, a retired nurse, recognized these critical signs and immediately drove him to the nearest hospital. Doctors quickly confirmed a diagnosis of bacterial meningitis. Thanks to the rapid intervention, Gregory made a full recovery. He later reflected that he had initially thought he was just feeling run down and had no idea it could be something so serious. This is the stark reality. When your body sends out such clear warning signals as a high fever, a stiff neck, and sensitivity to light, it is not overreacting, and neither should you. These signs strongly suggest that something is aggressively attacking your nervous system, and with meningitis, every hour counts. Effective treatment is available, and it is most successful when initiated early. Therefore, do not hesitate if you or someone you know exhibits these symptoms. Do not wait for a doctor's appointment or try to sleep it off. Go directly to the emergency room and allow the medical professionals to take over. You will never regret prioritizing your health and seeking timely medical attention. But delaying could be a risk you simply cannot afford to take. If you understand the importance of acting quickly on these meningitis symptoms, comment "Take action" below. Valued viewers, by now, you've witnessed just how crucial it is to pay close attention to the signals your body sends, especially as we advance in age. These 7 warning signs aren't presented to cause alarm. Rather, they are intended to empower you with knowledge. Recognizing when to seek immediate medical help is not a sign of weakness. It's a demonstration of wisdom, particularly the kind that comes from years of living and understanding that your health deserves immediate attention, not delay. It's easy to brush off concerning symptoms, thinking, "I'll be fine," or "it's probably nothing." However, as highlighted in many of the stories we've shared today, individuals were often saved because they chose to act promptly, because someone recognized the warning signs, picked up the phone to call for help, or drove directly to the hospital. These decisive moments made all the difference. And remember, taking proactive care of your health isn't just for your own benefit. It's also for your family, your friends, and all the people who care about you and need you in their lives every day. Every day you remain safe and healthy is another day they get to enjoy your wisdom, your stories, and your love. So, treat your health as the precious gift that it truly is. Thank you for joining us today. We would genuinely appreciate hearing from you. Please leave a comment below and share one key takeaway you learned from this video and how you plan to apply it in your life. Your thoughts are important to us, so please don't hesitate to share them. Reading your comments provides us with great motivation and encouragement. If you found this video informative and helpful, please take a moment to like, subscribe to our channel for more valuable health insights, and share this video with others who might benefit from this crucial information. Your support helps us continue creating valuable content to inform and inspire you on your health journey. Thanks for watching, and we eagerly look forward to seeing you in our next video. Remember to subscribe, like, and share this video to help spread this vital information. Before you go, don't forget to check out our other interesting and informative videos on various health topics. You might find something else that could be beneficial for you or your loved ones. Stay healthy and stay informed.